Hi everyone, Ellie Baldwin with Sunways Assisted Living Concierge, and we are here today with one of our favorite people, Dr. Angelo Domingo.
Hi, everyone.
And he is our guest blogger this week, which we are so thankful for. He is writing all about caregiver burnout. And it's something that he knows all too well and about all too well because he does have a mental health practice here in Sarasota where you have really built upon and specializing in the caregiver community and serving that, right?
Very much so.
So why don't you talk a little bit about that, about your experience and just kind of background?
Sure. So I started in neurosurgery, actually, not as a surgeon.
Right.
You don't want me cutting into your brain. But I started as a neuropsychologist.
Okay.
Working with the neurosurgeons doing evaluations on potential surgery patients.
Right.
And I got to know a lot about the caregivers and their struggles, and also the people affected with these horrible brain conditions and their struggles. So when I moved down to Sarasota in 2006, I decided to give up doing assessments and evaluations and focus more on therapy to help this underserved community.
Totally. Yeah. No, it's so, I mean, you know this is something and why we love what you do in your practice so much, because for Sunways and the clients that Mark and I serve, that caregiver journey is something that we're so passionate about, because finding seniors the right community and getting them the right care is so important. But the journey that those family caregivers have and just seeing the emotional stress and even what that turning into physical stress that they go through is so, I don't know, overwhelming for most. So in the blog, you talk about burnout specifically and how that caregiver stress can really lead to burnout. What are some of those signs? Like when is it turning from I don't know, maybe the average or typical kind of daily stressful situation to really crossing that line to a burnout situation?
Well, often what caregivers struggle with is a lack of perspective on what's happening to their loved one. They don't have the clarity because, frankly, we, the medical community, does a really poor job at explaining what's happening to their loved one. So there's no way for them to really understand what's going on.
And the journey is so different. Do you I mean, especially I feel like the type of patients that you typically serve being dementia, Alzheimer's, Parkinson's, the journey is so different. It's not like, well, here's your blueprint.
Right.
Here's how it's going to look. So it's like so overwhelming as a caregiver. What do I even anticipate, right?
Exactly. For example, one of the issues that often frustrates caregivers who are caring for somebody with Alzheimer's disease is people with Alzheimer's disease often don't know they have Alzheimer's disease. So they have no insight, they think they're perfectly fine, and they don't understand why people are treating them so differently. And for the caregiver, because nobody takes the time to explain to them that this is part of the disease, that lack of insight, they say, well, my husband or my wife is in denial. They won't accept that that's the condition. Versus caregivers who have a loved one with Parkinson's, where generally they have much better insight. But because that spouse can have a conversation with their loved one and their loved one understands it and responds, they expect
everything else to be in line.
Everything else to be in line.
No, it's such a good point. It's so hard. What do you think the main reasons are as a caregiver, because this is something that we talk about a lot as well? Why do you think it's so hard for caregivers to reach out to help, whether it's to somebody like yourself, to somebody like us, or any other of these other resources, even support groups, etc.? Like, why is it so hard?
Well, there are several reasons, and a big part of it is because when people are experiencing burnout, they're usually depressed, they're angry, they're irritable, they're anxious. Sometimes they snap at their loved one. there's a lack of empathy,
Yeah.
because of compassion fatigue. They're just all compassioned out.
Yeah. Yes. Like, where's the compassion for me?
Right,
here?
where
like,
is the
hello?
compassion for me?
Yes. No. Totally. Totally.
That's a really good point. I'm glad you brought that up, because they're so overlooked and they're so tired.
Yeah.
Tired.
Yeah.
So you have all of these symptoms of burnout, and then on top of that, they judge themselves for it. They start to feel guilty and feel ashamed
Yeah.
that they're having these feelings towards someone they love, and they don't want to tell anyone else that.
Right.
And often, sadly, when they do reach out to family or friends, people don't know what to do, so they
Right.
don't do anything.
Right.
So then they have these experiences of being rejected.
Right. Or like what to say. It's like,
Right.
it'll be okay.
Mm-hmm.
Like, what do you say if you haven't experienced that? No, that's a great point.
And lastly, often people will feel more isolated from their friends, because if you are in your 70s and most of your friends are in their 70s and 80s, and now you have a husband with dementia, I can't imagine a 70 or 80-year-old that wants to sit with someone who has dementia without feeling anxious themselves. That
Right.
could be me.
Right.
I don't want to
Totally.
see that. I don't want to look at that.
Yeah. No, 100%. It's like your own mortality, to a certain point. It makes, you have to ask those hard questions. I mean, I think being 70 or 80, or even at any age, because even if it's somebody even at my age, it's like you think about your parents, you think about your grandparents, and the fear and anxiousness that, you feel that come from that. So
That's a really good point.
yeah.
But you and I, at 29.
That's why I love you.
Yeah.
You're the best.
It's not gonna hit as directly home as it would for someone who can say, "My God, that could be me."
Right.
There,
Totally.
but for the grace of God, go I.
Right. Right.
So anyway, the caregivers end up feeling really isolated, and then when they do reach out, people don't react as they expect.
Right. Yep.
So their symptoms and problems go unspoken often.
Yep. No, and we usually, when they do end up reaching out to somebody like us or somebody like yourself, they're at such the breaking point, that you just wish that, and we hope that with our blog and with, us just talking about this as much as possible, it's really shining a light on trying to get ahead of it a little bit, Are there other, when we talk about reaching out to for help, right? What are some of, the most easily accessible ways to do that? Reaching out to family, a lot of times, like you said, or friends, you might not be getting the reaction that you want. You touched on a couple things in the blog. I know self-care was kind of one of them. And self-care can even be having the care for yourself, of knowing that you do need to ask for help, whether that be reaching out to somebody like yourself, and really taking an hour a week even to going to a support group, or going and talking to a professional like yourself one-on-one, where you can at least unpack some of this stuff. I mean, you're not going to solve the world's problems, but just unpack it for a minute, and just in a safe place be able to speak openly,
Having that connection to other people who understand,
right,
is incredibly powerful.
Yeah.
And there are terrific resources out there. I mean, here at Parkinson Place, I personally run a support group for caregivers that are caring for someone with dementia, specifically, any kind of dementia.
Right.
Every third Friday of the month, from 11 a.m. to 12:30, we meet right here at Parkinson Place. So if you're caring for somebody with dementia, please, please, please consider coming.
Yeah, and we'll post a link to all of that in the comments as well. And what is also, if people have more questions and want to reach out to you directly, what's the best way to be able to reach you to get some of this information?
By phone.
By phone, okay.
941-822-6122.
Perfect. And we'll also put the link to Dr. Domingo's website His email and contact information is also in our blog. We'll put the link to that as well so that you can reach that. We appreciate you so much and you serving this community because it is so underserved. And we hope that this brought light to you or somebody that you know. Please share. And we'll be back next week with more caregiver information. Have a great day.
Thank you.